Hi, this is Dr. Shah, and today I have Dr. Pandey with me today, and I'm going to allow her to introduce herself.
Hi, I'm Dr. Pandey, Shilpa Pandey. I am a sleep doctor and a pediatric pulmonologist, and I'm also boarded in obesity medicine. I have a practice, sleep medicine and pediatric pulmonary specialist in Metro West, Orlando.
Awesome. So I wanted her to come on today and talk a little bit about sleep disorders, especially as it relates to weight. One of my first questions is for her just to explain what sleep apnea is, and then when a person should think about getting screened or evaluated for sleep apnea.
Okay, so there is different types of sleep apnea, but the most common one that everyone commonly talk about is the obstructive sleep apnea. So the obstructive sleep apnea, it means that the upper airway is collapsing when you are sleeping and there is obstruction to airflow, either partial or complete obstruction. And that's the most common sleep apnea type that we talk about. But then the other two types are central sleep apnea, meaning that your brain just forgets to breathe. And the third type is mixed. So it has portions of both obstructive and central. So when should one consider to be screened? I think all patients should be screened because sleep apnea is just so prevalent. It's about 30 million adults in America have sleep apnea, and it's one of the most common disorders, which is missed or diagnosed very late, underdiagnosed. So I think that it is important that every physician should be screening their patients for symptoms of sleep apnea. And
What
if
are
they
what
will, so
are
symptoms of sleep apnea could be different for pediatric patients versus adult patients. So some of the common symptoms for pediatric patients may be excessive sleepiness during the day. So they may be falling asleep in the car while driving to school or falling asleep during tests or during classes in school. That could be a common complaint. Difficulty concentrating, difficulty focusing can be a common complaint. Early morning headaches can be a common complaint. With very little kids, sometimes they are spending so much energy in trying to breathe at night because their airway keeps collapsing and they have to use so much of their muscle to breathe at night that they can actually present with failure to thrive. So that could be one thing as well. And then, of course, in pediatric patients, also we talk about enlarged tonsils and adenoids being one of the common reasons for sleep apnea. So if that's something that is causing them to have that, then they may have difficulty swallowing, have recurrent throat infections and things like that could also be something that would trigger a physician to start thinking about sleep apnea in a patient like that, somebody who's snoring consistently, or parents are reporting that they are stopping to breathe at night or gasping for air at night. Those are things that they should be looking for. There are questionnaires which can be used for pediatric patients as well that can help us guide which patients should be evaluated further with the sleep study or further testing. Now, for adult patients, some of those same symptoms that pediatric patients have can also present with adult patients having sleep apnea, like headaches, like difficulty concentrating, focusing, memory issues, forgetting things, being forgetful can be a presenting sign. And then other things would be excessive sleepiness, tiredness. Sleep apnea definitely puts you at an increased risk for having accidents because you are just not focused enough and you're so tired. And so it increases your risk of having motor vehicle accidents and other accidents as well. Those are some of the concerns. And so, of course, if a patient is presenting with these concerning symptoms, family members are saying that they snore a lot or they are stopping to breathe at night and wife has to wake them up or is worried about them sleeping. They sleep with their mouth open, they're gasping for air in the middle of the night. They wake up feeling tired even though they slept enough hours. Those are all signs that should alert to be evaluated for sleep apnea. But I think a lot of time these questions are not commonly brought up during our visits. And so questionnaires are really handy in giving out and having that. An Epworth sleepiness scale is a questionnaire which is used for adults. It's very simple to be administered. You can give it out to the patient in the waiting room. They can fill it out, very easy to fill out and score. And if the score is 10, then it's concerning and patient should be referred for further evaluation.
Awesome. What is with obstructive sleep apnea specifically? I think a lot of the times people just think about the CPAP device. And so they're automatically like, oh, I probably have it, and there's no way I can sleep with that machine. How do you address that?
Yeah, that is, of course, the gold standard treatment for sleep apnea. The best treatment for sleep apnea is the CPAP device. But yes, there is a lot of fear about the CPAP device. There's not poor understanding of what it is and how it can be used. And then let me explain CPAP. Basically, as I explained, sleep apnea means that the back of your throat is collapsing, or you could have a big tongue, which is falling back and closing off your airway during breathing. So we want to treat that is obviously stent your airway open. So how are we going to do that? CPAP stands for continuous positive airway pressure. So it's a machine that we dial in a pressure, and that is, we do a sleep study. We diagnose that you have sleep apnea. We diagnose based on how many times you're stopping to breathe or almost stopping to breathe. So either it's apnea or hypopnea, and how many of those events are happening per night. And depending on that, we say you have mild sleep apnea, moderate sleep apnea, or severe sleep apnea. So mild sleep apnea is for adults. If you have up to 5 episodes per hour, is considered normal. So if we all can have some episodes of stopping to breathe, and that's not sleep apnea, that's normal. But if you're having more than 5 episodes per hour consistently, then you're considered to have sleep apnea. Now we put it into mild, moderate, and severe. So 5 to 15, and then 15 to 30 is moderate, and greater than 30 episodes per hour. So you're stopping to breathe greater than 30 times per hour is considered severe sleep apnea. So once we diagnose the sleep apnea and strategize it into mild, moderate, and severe, there are different treatment modalities. Again, as I said, the first line and the best treatment is the CPAP. So then the next study that is done after we've diagnosed sleep apnea is a CPAP titration study, where the patient comes into the lab, and they can also do an auto CPAP device, which can be done at home. So now sleep studies can be done at home. Home sleep studies can diagnose sleep apnea at home, which is another thing. Patients are afraid of coming to the sleep lab and sleeping in the sleep lab in the sleep study. But there are many devices which have come up, and they're very comfortable and quite accurate in diagnosing sleep apnea at home. So that can be done at home, and we can remotely access the machine and download the data and download everything and be able to diagnose it. And then we can also do the CPAP titration. So in the CPAP titration, we can do it at home with the machine, which is called an auto CPAP device, where the machine is quite intelligent and gives you different pressures and figures out what is the best pressure to stop your apneas. Or you can come in, and there are, of course, different patients that sometimes need to come in, and we can't just do the home, but that is an option for some patients. So for the patients that come in, we put the machine on them, and we do the titration with different pressures until the sleep apnea is well controlled. And then we say, this is your target pressure. So with that pressure, we are able to control the sleep apnea. And the way it works is it pushes air in on you put the mask on, and the air is being pushed in, and it keeps the airway open. So people always ask me like, oh, how am I going to tolerate this mask on my face? There's multiple types of masks, and there are so many options of masks that we really work with the patient in the sleep lab, with respiratory therapists, with the DME companies. We really try to get you a mask that is going to be comfortable. So don't be afraid of a CPAP device. Sleep apnea has obviously very bad side effects if it's not treated.
Yeah, the metal ones, the punches are very bad. Yeah.
A lot of bad consequences. Increases your risk of heart attacks and stroke and obesity and diabetes and heart failure. So once we diagnose sleep apnea, we definitely should 100% treat it. And CPAP can be done. As I was saying, there's different types of masks. So there's masks that go under the nose. There are masks that go over the nose. There are masks that go over the nose and mouth. There are masks that go over the whole face. There are different types of masks that can be used. And most patients, we are able to find something that works. Yes, there are some patients that it failed for multiple reasons, that we're not able to find something which is comfortable or tolerated well. And then in that case, we have other treatment options which can be tried depending on the type of sleep apnea you have.
So one thing that I want to add is, even if there's that fear of the mask, first of all, we don't even know. Like, we have signs of sleep apnea, but then we're not going to go get the study, or some people don't get the study because they're afraid of a mask that won't work. But I want just people to first go get evaluated and find out, do you have obstructive sleep apnea or not, or any sleep related disorder, truthfully, and then figure out the treatment interventions, not just wall it off. Because I do have several patients, actually many over the years, who do have obstructive sleep apnea. They find tremendous benefit using their CPAP device, to the point where they just noted the night and day difference. Once it was titrated properly, they felt their sleep was better, deeper. They felt more refreshed. Their headaches went away. Their blood pressure improved. And because of the link between poor sleep, incomplete sleep with obesity as well, we're able to fix one area and then also help the weight loss continue as well.
Yeah, that's right on the point, because that is really important. It is really important to go get evaluated for your sleep issues and then be able to be treated over. And don't be afraid of the CPAP machine. And CPAP is just one device, and with the multiple masks that we will try, yes. But beyond that, there are many other different machines which are approved by FDA for sleep apnea management, and many other things that we can do to help with sleep apnea. So there is quite a lot of options. And yes, with obesity, of course, it affects your sleep in many other ways. The most common is sleep apnea, but it also causes many other sleep effects. And that in in turn, it's like a cycle. It affects your hunger and your appetite. And then studies have shown that if you are overweight, you tend to not sleep well. You tend to have, of course, if you have so much weight on your neck, obviously it's hard for your body to breathe because you're laying on your back. There's this extra added mass. Now you have to work against to keep your airway open. So that's one thing, of course. And then it affects your breathing muscles. So you have like restricted lungs because of the weight as well. So it's hard to breathe again. And then obesity increases your risk of diabetes and high blood pressure and obstructive sleep apnea as well. And again, obstructive sleep apnea being untreated leads to further increase in your high blood pressure and your diabetes and metabolic syndrome. So difficulty losing weight. It affects your hormones and that affects your appetite. And studies have shown that if you are not sleeping well, then you tend to not eat well. You tend to eat higher calorie foods. And so your hormones are like that you choose to eat higher calorie foods. And that, again, it's hard for you to lose weight. If you're not sleeping well, you're tired during the day, you're going to be exercising very much if you're feeling so tired and fatigued during the day. So
Exactly.
and that will contribute to your weight. And so it's just a big vicious cycle. And we just have to, it's evaluating for your sleep problems, treating your sleep problems. It's a very important piece of getting to your ideal weight and getting healthy overall.
Absolutely. Can we talk about some of the other sleep disorders that can be associated with weight as well outside of sleep apnea, like interrupted sleep and so forth?
Yes. So definitely interrupted sleep. So obesity can cause circadian rhythm disorders as well. What that means is that we have an internal clock that helps our brain know when to go to sleep and when to wake up. And ideally for most people, we go to sleep at night and we wake up during the day. Our patients who are shift workers, right? So they are working at night and they're sleeping during the day. So they obviously have a circadian rhythm disorder, which is acquired because of their work. But obesity in itself has been shown to affect your circadian rhythm, and that affects, again, your weight. So that's one. The other one is insomnia. Insomnia is quite common in patients with obesity. Other things with obesity that come along with it, obviously, are going to affect your sleep. So if you are not at your ideal weight, you're heavy, then, you are at higher risk of having reflux, for example, right? Heartburn. And that happens mostly at night because you're laying down and all the food and the pressure is able to trickle back up into your throat, causes pain, discomfort, and you can't sleep well. Arthritis. So osteoarthritis is another one you caught with higher weight, your higher body weight. There's more pressure on your joints that you have osteoarthritis and that hurts. So you're in pain. So of course, again, you can't sleep. So sleep is affected in a lot of different ways. So we talked about insomnia, and then depression is another one with not being at our ideal body weight that can lead to depression, and depression as well can lead to having weight issues. So that is again a cycle. And then of course, both of those things in isolation or together will affect your sleep. So in depression, you have early morning awakenings and can't go to sleep. Sometimes sometimes like veterans will have PTSD and nightmares and they can't go to sleep. When they can't go to sleep, they try to stay out of the bedroom. And then when they're out of the bedroom, what do? They tend to watch TV and eat. And the choice of foods in the middle of the night is high calorie.
Yeah, it's like ultra processed foods because in the middle of the night,
Right.
we're not searching for an orange or an apple. We're not processed.
Salad. So
Yeah.
right. So you are again leading to more weight gain, more risk of obstructive sleep apnea. It's just so there are many different ways that obesity will affect your sleep. One of the other disorders that I want to talk about is obesity hypoventilation syndrome, which is also very thankfully it's rare, but more rare than obstructive sleep apnea. But that is common for patients whose BMI is quite high. And basically they're not breathing well. They're not exchanging air well. So because of that, their body retains carbon dioxide. Even during the day, their levels are high and then they have an abnormal sleep study. So for those patients, we do absolutely need to treat them. They are at higher risk of death. And so for that reason, we have to put them on different machines. And CPAP is one machine. There are other machines that can be used as well. PAP, which is bi-level positive airway pressure. And that sometimes needs to be used for certain patients with severe obstructive sleep apnea as well. And with patients who have hypoventilation or central sleep apnea. So with the level device. Basically, now in this one, you're going to have two pressures. So one pressure will be for when you're breathing in, and one pressure is going to be when you're breathing out. So it's a little bit more comfortable, more physiologic. And some patients, if they're not breathing well because they're having essential, we may have to put a respiratory rate as well. So that's another type of called a BiPAP ST device or BiPAP ST device, where we can put a respiratory rate. So there are multiple devices that we use depending on what exactly is the disorder that particular patient has. And we are able to figure out the best mode of treatment for that patient and make it most comfortable and therapeutic.
So this is, I hear, I'm going to share some similarities here. And also because you're obesity medicine certified as well. I think both of our practice styles are focusing treatments on the individual patient. And I think what people often find is when they come in to see me, they might say, I don't know why I can't sleep. I don't know why I'm gaining weight. I don't know. And usually like we go to Dr. Google and we'll start searching for things, but it's very cursory information. And what I'm hearing from you is that there is like so many reasons that someone can have disrupted sleep, whether it's sleep apnea, interrupted sleep patterns, obesity hypoventilation syndrome, like so many things, depression, arthritis. And if the right question isn't asked, and that usually comes from like an expert questioning them, then we can't get the right solution. So I also have seen before that if we've asked about like nighttime urination, like I think the first complaint I get sometimes, and you might get this too, oh, I'm getting up at night to pee all the time. And that is a sign actually of like obstructive sleep apnea. Like we're not hearing ourselves snore, but that little clue can just open the door to getting the right questions asked. So my takeaway from our conversation is that if somebody can't sleep, don't stop like searching for an answer, because sleeping and breathing are critical to our survival. And I think getting a sleep medicine expert like yourself involved is absolutely necessary to prevent all these complications that aren't really talked about too often, but they are at risk, like increased motor vehicle accidents, increased risk for worsening diabetes, high blood pressure. Like these are all cardiovascular conditions that reduce our quality of life and reduce our lifespan. And everyone wants to live well and live happy and healthy. So these things need to be evaluated. And I think what you've shared shows that there's so much more to sleep than just closing your eyes and calling it a day.
Right. Yes, absolutely. There is so much more. And as I said, we have to ask the right questions to get the right answers. And that's something, but there are many, as I said, questionnaires available. There are these trigger things that patients come in and complain about, and patients can come in with different symptoms. But yeah, it has to be someone who has seen it and does it all the time. And that's why we have experts in different fields, sleep medicine or obesity. And this is why, so that we can focus in and be like, okay, that is something that we see commonly with sleep apnea. And this is something that should trigger me to do this testing or that testing, and more focused exams and things like that. Yes, definitely.
Is there anything that you want to add today?
I think the main thing is, as you said, don't be afraid of the sleep doctor. There is much more to sleep than just sleep apnea. And there are many modes of treatments which can be used. CPAP is one of them, is the most commonly used and the most commonly known, but we have different ways of getting it to be comfortable. And as you said, most people who use it and their sleep apnea is controlled can't live without their CPAP machine. They carry it with them even when they go on family vacations. They cannot be without their CPAP because they now know the difference. That's the thing. Like if you've been sleeping crappy for a long period of time, you think this is how everybody sleeps. You just forget how it is to sleep and feel awake. And once you have a good night of sleep, the next day patients will come and tell me, oh my goodness, that was the best sleep I've had in years. I feel awake. I feel alert today. And all this time, I didn't know what was going on. I was drinking so much coffee during the day. I just never felt myself and always felt down, and I couldn't pinpoint it. And now this is the answer. It's just like a light bulb moment. You feel so good that you were able to help. And such a simple answer.
It seems like you went day in and day out, but I just want to repeat what you said, like to feel awake, to notice the difference, to get the best sleep, to be alert, to not have to rely on caffeine. These are things that just, when we're awake and alert, we feel better. And until we have that good night of sleep, we don't know. We just don't know how good we could feel until we start feeling better. And that's why I think if you notice that you're not rested, if you're not feeling well, if you feel lethargic, if you're relying on coffee, if you're getting headaches, if you just feel slow, if you're dragging, and you think sleep is the culprit, you need to see a sleep doctor. So where can they find you if somebody wants help with their sleep?
So we are sleep medicine and pediatric pulmonary specialists. So we are in Orlando in Metro West area. You can go to my website, which is www.nona, SMAPPS, SMAPPSFL.com, or search up my name, Dr. Shilpa Pandey, and give us a call. Our phone number is 407-900-1317.
Awesome. Thank you so much.
Thank you so much.